I just want to preface some of the things we're talking about deviates from mainstream medicine, but it's not like, you know how politicians say the party left them? Well, that's what's happened with medicine. They've left the people. They're not interested in the people. They're interested in just selling their drugs. And when I see the way
This way, so, okay.
patients are just handed out drugs like it's nothing, like there's no danger involved, like it's going to cure them, which it doesn't either. I say, well, that doesn't make any sense. But the whole system of healthcare revolves around selling drugs. That's what it's all about. But unfortunately, it doesn't revolve around keeping people healthy or trying to use the best and safest approaches to restoring health. So we're going to touch upon some of those topics today. And having said that, Janet.
Okay,
Janet.
I'm Janet. I do the radio show with Dr. Slavin. I refer to myself as the comic relief on the radio. And so I used to be doing nutrition counseling at Tooney's. And as of Friday, I am no longer associated with Tooney's. They are moving in a different direction. So the nutrition counseling services that I offered at Tooney's Nutrition Center are no longer available. And so one of the things is the timing was very, very good, because now, because of this seminar, I can let you know that yes, indeed, I am here at Dr. Slavin's office. And of course, I'm sure you also know, you've heard the rumblings, Al Foreman is about to get back into the business. So
Didn't hear that one.
you didn't hear that one. See, all the updates when you come to the seminars at Dr. Slavin's office. So yeah, very, very interesting news. So when that is up and operational, I'll be doing some things with Al Foreman. And of course, that's very soon after I received my nutrition counseling license, I began working with Al. So just a couple of weeks after he started his first store on Wiles and Riverside in Coral Springs, I began working with him. So we go back a very long time. And so Dr. Slavin and I go back a very long time as well. Had been doing the radio together for years and years and years. So what I want to talk to you about today are some of the new opportunities here at the Institute of Advanced Medicine. Dr. Slavin said, all right, the insurance companies are getting tighter and tighter and tighter with what kind of testing, not even the therapies, but what kind of testing they will pay for. And sometimes the invoices come back from the insurance companies, and the insurance companies have said, well, that test is not medically necessary. But the truth of the matter is, if you want to maintain wellness, it is necessary for wellness, necessary for evaluating your function, necessary to keep you very well and highly functional. And so, you know, we say it over and over and over on the radio show that, okay, I'm going to take this medicine and it's going to prevent a disease or treat a symptom. And the truth of the matter, deterioration continues, and you are out of dollars because you've paid co-pays, you've paid in addition to for your medication, and you haven't achieved the wellness and health support goals that you had in mind. And so here, Dr. Slavin is offering lots of really good things. So I will be available to do some nutrition counseling sessions, and I just wanted to tell you about some brand new opportunities here at Dr. Slavin's office, and I'm talking about intravenous treatments. And the reason that we came up with this idea is many of the people that I speak with, they're not necessarily achieving their goals with the nutrition supplements that they're taking. And so many people may be taking a literal barrel full of vitamins on a weekly basis and are getting tired of it. I understand that viewpoint for myself because I've been taking these vitamin supplements for years and years and years, and so I'm trying to navigate a way where I don't have to swallow quite so many things. So we moved from taking those individual pills to taking our nutrients in a shake in the morning. And so there are some benefits and some negatives to that. The benefits to the shake is, okay, you can drink everything down. You don't have to swallow many, many different capsules and tablets. Nothing gets stuck in your throat. You can make it taste very, very good. So it would be a beautiful substitute for breakfast for some people. And so after a while, maybe you get tired of that. Cleaning up the blender every morning. Maybe you're someone who is taking very specific interest in using fresh berries, fresh fruits, and maybe some greens, and washing and preparing all of those and blending those or juicing those. It's a lot of work. So here's another option for you, and it is so efficient that you might not necessarily have to do it all that frequently. And what I'm talking about are the intravenous wellness treatments that we're considering here, or we're doing here at Dr. Herb Slavin's office. So one of the areas that was very surprising to me was how many different focused treatments there are. When I started doing a little bit of the research to see how beneficial these intravenous treatments could be, I was amazed. And I'll tell you the two that were most interesting to me. There are specific intravenous treatments for glaucoma and macular degeneration. I talk to a lot of people who have been told that they've got macular degeneration. The doctor is very specific, whether it's wet or dry, and the doctor kind of shrugs their shoulders about, well, what are we going to do to stop the degeneration? Well, here's this medicine. It won't really stop it. What we're focused on is slowing it. So here's an intravenous treatment that is going to be specifically directed to your vision, improving the situation with eye pressure, with the glaucoma treatment, and seriously enhancing your nutrient status so that macula area of your eye begins to operate in a very advantageous way, and you don't have the continued degeneration, because that's what we're talking about here. Macular degeneration, they diagnose you, and it is a known situation that continues to deteriorate until your vision is dramatically affected. I'm sure all of you have heard of a glutathione push. There are so many very specific instances where a glutathione push is very effective. One of the most very well known and very well researched has to do with Parkinson's disease. And it was Dr. David Perlmutter in his neurological practice in Naples, and he was very, very well known for documenting the important changes with neurological damage when you did a glutathione push. But what does glutathione do? Glutathione enhances every one of the antioxidant functions in your body. Glutathione lengthens and strengthens the activity of antioxidant nutrients in your body. So if you're interested and focused on cellular optimization, glutathione, the intravenous glutathione push is just a dramatic support to overall good health. And if you have any neurological issues, then the glutathione push is actually therapeutic. Vitamin C intravenous treatments. Years ago, I had the opportunity to attend a seminar given by a Dr. Reardon. And there is now the Reardon Clinic in Wichita, Kansas. And that Reardon Clinic teaches practitioners how to use intravenous vitamin C to the very best advantage. And there are 2 intravenous vitamin C treatments here at the Institute of Advanced Medicine. Intravenous treatment with a 50,000 dose and a much more intense treatment, a 250,000 dose. And the practitioners here are trained with the protocols from the Reardon Clinic. So fantastic vitamin C IVs. And then I just go down the list. There's one specifically for energy. So you feel the dramatic support to your energy after this IV. And one of the reasons that we started talking about this, more and more people are understanding that an intravenous treatment gives you immediate response. It might not necessarily be the complete response that you are able to achieve with this treatment, but immediately you feel a difference. So an energy IV. There is an immune system IV, and there are different overlaps, like I talked about the glutathione and enhancing antioxidant nutrients. Well, it would be a discussion about which is more appropriate, the glutathione push, the immune IV, what specifically is the most beneficial approach for each individual. There's one for diabetes. So if you've been diagnosed with an elevated A1C, maybe your fasting glucose level in the morning is higher than it should be. Maybe you have been fortunate enough to have been directed to a fasting insulin test, and your insulin level is too high. People might have a mistaken view about insulin. Insulin is a damaging hormone. That elevated insulin level can be contributing to damage to your vision, to your kidneys, to your circulatory system. So very important to achieve that insulin glucose balance that is steady and predictable. And along with that balance to your blood sugar, you are going to minimize the damage associated with unpredictable levels of insulin and glucose. Weight loss. I was telling someone earlier, people come and see me and they have some really serious diagnoses. What's the first thing they ask me for when we sit down to talk about what are your goals, what do you want to achieve with this counseling session? Top of the list, weight loss. So here's an intravenous solution that's going to support your approach, whatever you're choosing with regard to maintaining your weight, optimizing your weight, burning fat. What you do with regard to this weight loss intravenous approach is you would evaluate your body composition, because plenty of people may have a slim and trim figure, but the body composition, lean muscle mass to fat ratio, is not optimized. So that's what you want to evaluate, and then you can focus your efforts in the correct direction. Memory support. This Thursday I am doing a presentation for caregivers for an Alzheimer's facility, and the projection is that in the next 30 years, the people who reach the age of 85, half of them will be dealing with memory issues. So what are we going to do to prevent those memory issues for us? Maybe the rest of the world is eating their Snickers bars and poor quality ice cream, or my favorite, the no fat, no sugar frozen yogurt. And my statement is, oh, okay, what's in it then? There's no fat, there's no sugar. Tastes creamy, tastes sweet, but it's no fat, no sugar. And so it's full of chemicals. And it's those chemicals that our bodies don't necessarily know what to do with, and contribute to accumulations that adversely affect not only our bodies but our minds as well. So there's a memory support IV. Blood pressure balancer. How many people are on blood pressure lowering medication and then they visit their doctor and unfortunately their blood pressure is just a little too high? Okay, here we'll give you another blood pressure pill. And so they're on 2 or 3 different medications and they're walking like this. Their blood pressure's right where their doctor wants it. But do they feel well? No, they feel very fatigued. So here's a way to naturally balance all of the functions of your body so your blood pressure is good. So blood pressure and circulatory health, just a general nutrient IV, kind of like the multivitamin, multimineral intravenous treatment. How many of you have heard of a Myers cocktail? Okay, so a Myers cocktail. You wake up in the morning, yeah, your throat's a little scratchy. Oh, maybe your head isn't just the way you usually wake up. Myers cocktail, very easy, probably less than half an hour to receive the mixture. It's minerals and vitamins that are very supportive of your immune system and help you short circuit moving into a full-blown illness. There are so many new opportunities here for supporting wellness at the Institute of Advanced Medicine. Heart rate variability tests, that is paid for by insurance. Have you heard of the heart rate variability test? Okay, a very simple test where you put a little clip on your finger, you sit quietly for 3 minutes, and it gives you a printout information about how well balanced your sympathetic, parasympathetic nervous system is. And that it gives you an indication of how well you're handling stress. It even gives you a readout on what is the perceived stress hitting you on a daily basis. And certainly over the years, if we've learned something, we've learned that stress underlies so many of our physical illnesses, the deterioration that is associated with all of the different systems of our bodies. So the heart rate variability test will tell you how flexible your blood vessels are. So, I'm taking this cholesterol medication, this medication that's possibly hurting my liver. It's getting my cholesterol numbers down, but am I forgetting my keys? Forgetting what I have to do today? Is my immune system suffering because of those pharmaceuticals, medications? So here's a way to evaluate your need for circulatory support. Then, of course, how many of you still have mercury silver fillings? Okay, nobody. Fabulous. Oh, okay. All right, very important to find a holistic dental practitioner who does the right procedures to remove the mercury, because when they're drilling out that mercury, it becomes vaporized and you can inhale it. So you need to have a mask and oxygen. And when they're drilling out that mercury filling, little microscopic particles may be swallowed. And so you can evaluate where you stand with regard to mercury intoxication. And it's the mercury intoxication that contributes to neurological problems. So it becomes this very, very big picture. And for each individual, you have to figure out what your priority is. And everyone has a different priority. And so one of the other things that I wanted to tell everybody about is PRP, platelet-rich plasma. And many people may be aware of PRP as kind of an aesthetic procedure. When you inject platelet-rich plasma into certain areas of your face, that platelet-rich plasma allows regeneration of tissue. Well, we don't just need it in our faces. How about in our joints? So many people have neck and back problems. So there are procedures available here, injections of platelet-rich plasma and stem cells to relieve joint pain and just enhance the strength of different vulnerable areas of your body. So you can schedule an appointment with me. I will be doing nutrition counseling here. I do want to mention that I have a whole array of Janet's Best products. And for none of you here are so interested in Slender, but this is a very comprehensive formula to help reduce appetite, support your metabolism, and enhance fat burning. And I have Janet Juice. All of these different Janet's Best products are available here at Dr. Slavin's office. And of course you can hear all about them on Natural Doc Radio. And my guess is you can hear about the seminar, or if there are any details that you've missed during the seminar, you can go to drslavin.com and find out all about the options available here at the Institute. And so now Dr. Slavin will be telling you all about his research and his opportunities here.